Rubbing alcohol will complete the sterilization of these instruments.
No, it will not. Those instruments will never be sterile. They were not sterile to begin with,
I'm
and
ready
they
to
will
die
never be
forever.
sterile. Hello everyone, this is Dr. Juan coming at you straight from CaviTV, and in today's video we're going to be looking at lady takes her tooth out at home. Let's take a look.
I save thousands of dollars on not going to the doctor and the dentist.
Karen?
But recently
Of course her name is Karen.
I've encountered a really bad toothache. These past 2 weeks have been horrible.
You know, a little bit about toothaches. I know that it can be the worst pain ever, and it can be extremely debilitating where, it'll keep you up at night, worse than even childbirth, I've been told.
I've tried clove oil, I've tried ice, I've tried everything over the counter and nothing worked.
When it comes to tooth pain, if you notice that something's hurting and then it goes away, probably not that big of a deal. But when something's hurting and it keeps getting worse and worse and worse, you probably want to call that dentist phone number. Give them a call, make an appointment, get that taken care of sooner rather than later, because things at that point can only get worse. The earlier on you go, the better off you'll be.
And I finally gave up. I just had to go to the dentist.
Let's take a look and see what's going on, okay?
I like this guy.
All right, Karen. Well, you definitely have an abscess on that tooth, okay?
All right.
You've got to do something or it's going to...
What an abscess is an infection on a tooth. Do you have an infection in there? And how did this infection occur? More than likely because of a large cavity. So the large cavity seeped into the inside of the tooth, and ultimately what can happen after that, your body can form a little tunnel to secrete out the pus. It's called a sinus tract. And it looks like a pimple, and little bits of pus get thrown out from there in order to help get the infection out of there. Usually you'll have a really bad breath, and this stuff tastes nasty. One of the only ways to really treat an abscess is, two main ways. Either take the tooth out, that'll get rid of the problems, or you can also do a root canal. A root canal means that we go in there with little instruments, small files, cleanse, shape the inside of the tooth, put a filling material, and then we can put a crown on top of the tooth afterwards. Which brings me to my next, point. This toothache that she's having could have been prevented earlier on had she gone to the dentist more frequently. And this is a reason why I tell people, look, if you don't have insurance, or you know that your insurance is going to be running out, go to the dentist. Get everything taken care of. Listen to what your dentist tells you. Listen to what your hygienist tells you. If they're saying floss every day, or if they're saying, hey, there's a little area over here we're not liking too much, it's starting to look suspicious, get all those things taken care of and be as good as you can with your brushing, with your flossing, with your eating habits, drinking habits. That way you lower the chances of anything happening to your teeth.
Well, a cheaper option is to pull the tooth, but once we pull it, it's gone.
How much is that going to cost me?
About $185.
Would it be cheaper if I went without any anesthesia?
That's not a good idea. You're not going to be able to stand the pain if you try to pull this tooth without numbing it.
When someone comes at me with tooth pain such as hers, I have yet to have anyone ask me if I would do it without anesthesia. Not a chance. Never, ever, ever, ever would I even do that. At that point in the game, I would just say, you know what? I want you to be as comfortable as possible. If you want me to do something that, where you're going to be kicking and screaming, I'm not your guy. I'm sorry.
No.
I'm knowledgeable. I'm college educated. So if there's a medical procedure to be done, it is researched to great lengths.
This is an elevator. That's what we put down into the gums and twist it against the bone, and it actually pushes the tooth out of the socket until I can grab it with this forceps that actually wiggles the tooth out till it gets loose, and then we pull it out.
Well, that just looks like a...
Yeah, those are very common instruments that I use on a daily basis. The elevator, the first instrument he was mentioning, is used to, move the tooth back and forth and push onto use leverage forces in order to get the tooth out of there. It is about loosening up these little fibers that you have around your tooth. And then afterwards, we go in there with forceps, with the ones that look like pliers. They're not pliers, though. They're not pliers. To deliver or just take the tooth out of there.
I mean, you take your time, but the longer you wait, probably the more it's going to start hurting.
Oh no! No! Please do not. Please, please, please. I am telling you, never, ever, ever do any at-home dentistry. This is not going to end well. Things that you can do, you can try, different whitening strips, things like that, things they sell over the counter. But when it comes to you doing your own fillings at home, your own extractions at home, never do that, please. Never. Going back a little bit, Dr. Snow here, one thing he did not mention is the use of antibiotics. Many times we prescribe antibiotics when there's large infections or even normal infections having to do with abscesses. The little sinus tract or the little bump at the side of your gum goes away. And a lot of patients feel that the infection is gone. Many times they don't know that this kind of infection will reoccur. It will come back no matter how many antibiotics you take or for how long.
I think I want you to take my tooth out.
No! No. No way.
Karen Heard
no
and her
way.
husband have performed various medical procedures at their home before, but now, for the first time, they're attempting a tooth extraction with the aid of some online videos.
I don't like the idea of pulling my wife's teeth.
Those are rusty forceps. I would never in a million years want anything to go near my mouth that has that amount of rust. Not a chance.
Teeth out. What if I pull the wrong one or something, But my wife threatened to take her own tooth out, so this needs to be taken care of.
Benzocaine is a numbing agent. I'm going to use benzocaine to numb up my gum so that when my husband pulls my tooth, I won't feel anything.
You will feel everything. Benzocaine, or topical, otherwise known as topical anesthetic, will only numb the superficial portion of your gums, up to 3 millimeters in depth. Anything that he's doing, any pushing and pulling, you will be feeling sharpness. No, trust me, benzocaine is not enough. In dental practice, we do use benzocaine, we do use topical anesthetic, the jelly, in order to numb up the gums before we go in there with local anesthetics or the actual shot in order to achieve profound anesthesia or in order to numb you really, really well. Without the use of the shot, you are not going to be numb, especially for extractions. Not a chance, not a chance.
I won't feel anything. The extraction will actually take place using this barber's tool. We found it at a yard sale, used back in the early 1920s and 1930s for when people used to go to the barber rather than a dentist to have their tooth pulled.
I'm building a vacuum for her mouth. I'm using a regular vacuum cleaner. And I'm going to stick out in part of the mouth and we can suck out the blood and whatever, and a straw with duct tape.
At this point of the procedure, having suction is the least of your worries. That would be the least of my worries. Pretty ingenious, though.
This regular cola. Phosphorus acid in the cola dissolves the rust in the metal. scrape it off with aluminum foil. Rubbing alcohol will complete the sterilization of these instruments.
No, it will not. Those instruments will never be sterile. They were not sterile to begin with, and they will never be sterile. Alcohol is not a good liquid to sterilize anything. Okay? Coke and alcohol, not good. Not good. What we use in dental practices are autoclaves. Autoclaves are big machines that use heat and steam in order to sterilize the instruments the right way. We do not use Coke products. We do not use alcohol products to sterilize instruments. And I don't think anyone should ever attempt this, of course.
Karen's dentist would have charged $185 for the tooth extraction. But because she already had most of the supplies on hand, the procedure will only cost $10.
How's your mouth?
It's numb.
Okay. Yep. I think you got it.
It's that easy, guys. It's that easy. A little pulling, a little tugging, and it's good to go. Now I know. I need to stop here. Just no. This is all acted, okay? This is all acted. If you haven't realized it by now, this is not real. That blood was not real. You know, one interesting thing about the video, it wouldn't surprise me if the husband received some sort of training when it comes to pulling the teeth. It all just seemed too natural, like he practiced a couple of times. I'm surprised that he just didn't go in there and try to pull it a different way. I'm sure he was given some tips and tricks on how to, make things look better for the camera. In reality, if you were trying to do this, what most patients end up doing in these cases, they end up breaking the crowns off. So they break the tooth in half, leaving the root portion, the lower half portion of the tooth, inside of the gum. Often they think that they removed the whole tooth out of their mouths, but they just broke it, and they might have just made things a lot harder for them in the future. Okay, so guys and girls, the lesson of the day is do not do this at home, obviously. Go to the dentist. Prevention is key. This lady could have saved herself a lot of money if she had gone to the dentist early on. Does this actually happen in reality? Yes. Does it happen the same way that it happened here? Absolutely not. Like I said, all the cases that I've seen where people are pulling their own teeth, the teeth end up breaking. I guess the only times where you might lose a tooth and it comes out whole is if you have severe bone disease, and at that point the teeth are loose to begin with. You can just pluck them out of there. If you enjoyed this video, make sure you hit the like, subscribe, and comment on my video, and I'll be making more of these videos in the future.